Welcome, everybody. Good morning, good afternoon, good evening, wherever you are. Thank you so much for joining. We will start now, and hopefully other colleagues will join us soon. So I will just start by giving an introduction to the event, to the whole week, and to this high-level event. Just to start by saying that this event is to kick off the World Antimicrobial Awareness Week campaign for Africa 2021. And this campaign is under the regional theme, AMR Governance, Preventing AMR is Everyone Business. And it's
E prevenir a resistência antimicrobiana é uma responsabilidade partilhada. Nós partilhamos esta responsabilidade.
Before we start, a few housekeeping rules. Please introduce yourself in the chat box, your name, title, and affiliation. And also, please rename yourself to show your affiliation or organization in your profile. How can you do this? You click on your name, right-click on it, and you can see the button More, and you choose Rename. There you can enter a new name or add your affiliation to your name and click Rename and save it. Please mute your microphone when other people are talking or you are not the speaker. Be mindful also of the background noise. For questions, please put them in the chat box and the presenter will try to answer them either in the chat or live on the screen. Kindly note that we have interpretation services available in French, Portuguese, and Arabic. And for the Arabic interpretation, you have to click on the button Korean. And to go to the interpretation, you go to the control panel of the Zoom. It's under the screen. And you see this globe, the sign of the globe, and under it, interpretation. You click there and you choose your preferred channels. All right, after this few housekeeping, we will start with the background. Why we are interested in doing this campaign to raise awareness about AMR? Because antimicrobial agents, including antibiotics, have saved millions of lives, substantially reducing the burden of disease in people and animals, improving quality of life, contributing to better food security and safety, and also aiding to increase our life expectancy and our life quality. However, the emergence and spread of the antimicrobial resistance in several microorganisms is reversing these benefits and further complicating the management of many infectious diseases that should be easy to treat and cure. AMR is a major threat to our human development and to our fight against infectious disease and epidemics and pandemics. It also endangers animal health and welfare and food production. Moreover, AMR adversely affects the functioning of our human, animal, and plant health system and economies. AMR requires a collective and practical response to address it. So to mitigate AMR risk, we need a holistic approach. And that's why the Food and Agriculture Organization of the UN FAO, the World Organization for Animal Health, OIE, and the World Health Organization, WHO, what we call the tripartite agencies. Sorry, kindly mute. Kindly mute everybody. Yeah, thank you. So we were saying that the tripartite are working closely together at all levels to achieve this, and also with our colleagues in the Sorry about the interruption. We were saying that AMR requires a collective and practical response to mitigate it. So the One Health approach the holistic and the integrated approach should be used. And that's why the tripartite agencies are working together with the African Union AMR Task Force to achieve this at all levels. And this year focus is about AMR governance. And why governance is essential? Because to promote sustainable action, we should include proper institutional arrangements, and this arrangement should be met with robust societal demand from both the public and the private sectors to be able to successfully govern antimicrobials, emergence, and spread. We have done so much in our region. Several promising first steps were taken at our regional level, at country level, and also at the global level, but more can be done. So our goal is to raise the awareness on AMR governance and to take stock of progress in our region. And that's why we have this campaign and this high-level event. The objective is to unite all the sectors, all the stakeholders around AMR, and to strengthen and renew our commitment and advocacy effort for AMR governance. Under the governance theme, we will look at four main areas of focus. The first one is about adopting a One Health approach and multi-sectoral coordination mechanisms for AMR. The second is implementing and financing AMR National Action Plan. And the third is overview of the legal framework and legislations relevant to AMR. And the fourth one, it's about the role of civil society organization, grassroots organization, and professional associations in promoting and addressing AMR. We hope that by engaging this wide range of stakeholders and audience, this campaign will be able to raise awareness on AMR issues, and mainly about the roles, the responsibilities, the regulation, and the mechanism for collaboration among the different sectors to create a holistic understanding about the role of society as well, and encourage best practices among public, youth, health workers, farmers, and policymakers to prevent further emergence and spread of drug-resistant infections. So today, we are very grateful to have with us this group of esteemed speakers who will discuss this four main issues about AMR governance. And before we dive in, we will show a quick video to illustrate the issues around AMR. So kindly, if Lynn, can you provide the videos? Or Bas?
Once upon a time, the Earth was a huge playground for us microbes. Those were joyous days. We were wild and free, helping or hurting people and animals as we wished. Then one day, humans invented antimicrobials, weapons that took this power from us and put them in control. We were no longer free to cause pain, disease and death among humans, animals and plants, but we waited. And humans made a fatal mistake. They used these precious medicines indiscriminately in humans, plants, and animals. And some of us realized we could develop a defense to these antimicrobials. Humans call this phenomenon antimicrobial resistance. We call it taking back control. Now we, the disease-causing microbes, can spread wider and faster where disorder, dirt, and disorganization reign. It's great for us when you have poor hygiene and don't use water and soap. We love when you flush your unused antimicrobials down the sink or toilet. They join our already huge colonies in your wastewater and river systems and make us stronger. Poorly managed hospitals are good for us. In these places, we're free to multiply and become new ruthless killing machines. Antimicrobials given to animals not to control or treat disease, but to make them grow faster. Create new armies of microbes that become increasingly resistant. The beautiful thing is that the simple contact between infected animals and humans can allow us to spread. We can also circulate in contaminated food, on plants, in the soil and in water. We can be everywhere. We've regained some of our old powers. However, I am becoming very worried. Our enemies are starting to work together. International organizations and countries are starting to coordinate all sectors, from human, animal, and plant health to agriculture and food safety, to halt our glorious expansion and stay on top. They explain to people that we can be stopped by using antimicrobials as per licensed health professionals, such as doctors and veterinarians' advice, and not for growth promotion, by adequate wastewater management, and by having proper hygiene and cleanliness at the hospital and at the farm. Humans could become wiser and keep us down. A disaster. Imagine if everyone listened to their advice. I am no longer safe. My ability to resist antimicrobials could disappear. Don't let antimicrobial resistance take control. Be responsible when using antimicrobials.
Thank you very much. We will start now our first panel, and the topic will be about adopting a One Health approach and multi-sectoral coordination mechanism for AMR. And we are honored to have with us Dr. Abdel Hakim El Awar, Assistant Director General and Regional Representative for the Near East and North Africa for the Food and Agriculture Organization of the UN FAO, to provide opening remarks for us. The floor is yours, Dr. Elwar.
Shadia, thank you very much. Good morning, everyone, Excellencies, ladies and gentlemen, all protocol observed, with all the colleagues commemorating this Awareness Week on a very important, very critical subject that is, of course, hits on our lives and on our future of livelihood. It is my pleasure to represent the Regional Office for Near East and North Africa of the Food and Agriculture Organization of the United Nations, FAO, with Egypt, Sudan, Morocco, Tunisia, Algeria, Libya, and Mauritania on the African continent under FAO Near East and North Africa Office. This is a very important event that brings together distinguished high-level speakers of different organizations from various disciplines across different national and regional levels from African continent. Today, I'm delighted to join the leaders of 5 regional organizations in Africa in calling for stronger governance to fight antimicrobial resistance on the occasion of the World Antimicrobial Awareness Week 2021. FAO is working closely together with its tripartite partners, the World Organization for Animal Health, WAAW, the World Health Organization, WHO, to respond to AMR challenges in a multi-sectoral One Health approach. We all know that misuse and overuse of antimicrobial drugs in human medicine, veterinary medicine, and food production are accelerating the development and spread of antimicrobial resistance, AMR. As a result of drug resistance, antibiotics and other antimicrobial medicines become ineffective and infectious, and infections in humans and animals become increasingly difficult or impossible to treat, with the consequence of higher risk of disease spread, severe illness, and health. And I think the video that we just seen affirms all this. The COVID-19 pandemic has shown the ease with which infections can spread threaten global health security, and destabilize economies, lives, and livelihoods, challenging the effective delivery of the Sustainable Development Goals. Despite increased efforts at global, regional, and country level, AMR continues to pose severe threats to human, animal, plant, and environmental health, undermining livelihoods, food safety, and global food security. Transboundary animal diseases and zoonotic diseases have a devastating impact on animal production, food security, trade, public health, and economic development. A responsible use of antimicrobials in animal and plant health and production is crucial to control AMR. Without coordinated and accelerated action, rising levels of AMR could lead to millions of human deaths every year and hundreds of billions of dollars lost in annual economic growth. AMR requires coordinated multi-sectoral action, recognizing the interconnections between people, animals, plants, and their shared environment, as well as the engagement of public and private actors as part of the One Health approach on a local, national, and international level. Many countries have developed the national AMR action plans under the framework of a One Health approach, engaging ministries and all stakeholders from relevant sectors to contribute to the fight against AMR. Effective implementation of AMR actions plans depend on establishment and strengthening of coordinated mechanisms across sectors in government, private sector, civil society, academia, research institutions, media, and communities. One Health has been defined as one of the 20 program priority areas for the FAO Strategic Framework 2022 to 2031, endorsed in June 2021, to support the 2030 agenda through the transformation to more efficient, inclusive, resilient, and sustainable agri-food systems for better production, better nutrition, better environment, and a better life, leaving no one behind. The FAO Action Plan for Antimicrobial Resistance 2021-2025 has been developed as FAO commitment for combating AMR. One Health collaboration and communication is crucial in obtaining coordinated planning and response. As part of the efforts, the Food and Agriculture Organization, in collaboration with WHO and OIE, is establishing in all regions AMR multi-stakeholder partnership platforms with the purpose to bring stakeholders across all sectors together for a smooth implementation of the AMR Global Action Plan. Let me reaffirm FAO's fullest commitment to support the continuous effective coordination and collaboration with all partners and organizations in Africa and worldwide to combat AMR. I would like to thank you all for your attention and wish you all a successful and fruitful World Antimicrobial Awareness Week 2021. I thank you.
Thank you very much, Dr. Abdel Hakim, for this very informative and insightful opening remarks, explaining and emphasizing the importance of working together, not just international organizations, but also all sectors and all segments of the societies, so to be able to effectively control and prevent the emergence and the spread of AMR. Thank you so much for this. I will now welcome our panelist, Dr. Karim Tunkara. He is the regional representative of OIE for Africa. Welcome, Dr. Karim. We have also with us Dr. Yahya Ali Ahmed, the team leader of antimicrobial resistance for WHO African Office. on behalf of Dr. Mwete, the Regional Director for Africa. Welcome, Dr. Yahya. And I will start by the first question to Dr. Karim. Our panel, it's about adopting a One Health approach and multi-sectoral coordination mechanism for AMR. So my question is, why do you think it's of critical importance to adopt this One Health approach to control AMR or to tackle AMR? How do we ensure that a more comprehensive approach that address also wildlife, aquaculture, and the environment, not just animal and livestock or human health? Over to you, Dr. Karim. I think Karim has issue with communication. Dr. Yahya, are you there?
Good morning.
Good morning. You can start.
Good morning, ladies and gentlemen. First of all, I'm really happy to participate in this important meeting. And based on the questions so far that has been asked, allow me just to highlight that the One Health approach is really aimed on optimal health, not only for people, but also for animals and environment. Unfortunately, we have evidence that there is a misuse of antibiotic by community without prescription. And this could lead that animals may acquire resistance from, for example, water contaminated with human sewage. We have several issues in our region, specifically inadequate hospital sewage system that can be the source of animal contamination. In the other hand, colleagues in FAO and OIE might further elaborate, but I just need to highlight that we have evidence that there are antibiotic or antimicrobial use for prophylaxis and growth promotions in food production. So we can say that food producing animals might disseminate antimicrobial resistance to the environment. So these examples highlight that there is really an interface between human, animal, plant, and environment. So if a single sector needs to work alone, it will fail. This is the reason that we really need to adopt an integrated and holistic multi-sectoral One Health approach in combating AMR. And fortunately that member states are using the Global Action Plan to develop the National Action Plan in the context of the One Health approach. And it's really help on promoting multidisciplinary and holistic involvement of different sectors using the One Health approach for combating AMR. Thank you.
Thank you very much, Dr. Yahya. Dr. Abdel Hakim, would you like to comment on the One Health approach further?
Yeah, Chalia, thank you very much. I think it's the term expresses itself. One Health is the health for everyone. Today's world is very well and very much connected. And it's unfortunate that a human being takes in so long time to realize the interconnections and the impact one sector imposes on the other. Now, we just followed the COP26 agenda and we saw the outcome. We're talking about water. If we don't have water, we will not have food. And if we don't have food, we will not be able to survive. We will not be able to feed our animals that we survive from. So it's a whole chain of interconnectivity that one is like a domino effect, one impacts everything else. And we come to a very important issue on the antimicrobial resistance, where now we have a lot of transboundary diseases that cross borders, but we also have diseases that cross between animals and humans. And we rely on animals either directly or indirectly on our food source. There's an impact on the climate as well. And then the connectivity with the water source. So I would go even beyond about animal health and human health, and we should of course bring in the environment health, which is the new concept of the One Health. The One Health is a comprehensive approach of where the sectors. It's already implemented at a global level where WHO, OIE, UNEP is joining and FAO coming together, but that's not enough. The countries themselves need to look at One Health as a real strategic way of resolving issues at the country level and the regional level. So those sectors has to come together. And also that applies to the research, academia, civil societies, the private sector. I mean, we know private sector is an investment and profit driven, so they will run where the business is. That's fine. They will still provide support. We need them, of course, to finance the process. But the research and academia and civil societies have to really closely come and think together. How do we make sure that we get healthy food? How do we make sure that our animals that we live on are fed with the healthy food, and that we are not building, I would say, a global resistance that we will bear the consequence of. One Health is a one approach, and it needs partnership, and we link it to the SDG 17, where the partnership is needed to achieve all the SDGs. One Health taps on food, zero poverty, zero hunger, water, climate, and industrialization, and all many aspects. And we really need to, if we want to get those SDGs closer, we're not talking about achieving them anymore with the COVID-19 or getting off target, but to get closer to achieving them, we really need to work together under the One Health approach. Thank you.
Thank you very much. It's really important to highlight the role of the environmental sectors, but also how some perceive it as public health issue or emergency like AMR impact on all sustainable development, not just on the health of the humans or the health of the animals, but also on our economy, on our society, how we function. I would like now to call on Dr. Karim Tunkara from OIE to tell us how OIE is embracing also this comprehensive approach of One Health, and including wildlife health and aquaculture in the work on AMR. Over to you, Dr. Karim.
Thank you, Chadia, and sorry for the poor connection. I'm not in my office. Sorry, really sorry about that. So thank you for this very, very important question, and I'm very happy to be part of this panel. And I see some really faces I knew. Hi, Hakim and Ali. So I'm very happy to be with you all and to talk about this very, very important subject of AMR. All of us, we are concerned, no matter where you are, no matter who you are, no matter how you are working, we are all interested, we are all concerned about this subject. So coming to your question, I would like to mention that the threat of emergence and rapid geographical dissemination of antibiotic resistant genes and the integrated ecosystem of the transfer and spread of antimicrobial resistance illustrates the critical importance of a One Health approach and the need for a better integration, as you said, of environmental, aquatic, and wildlife issues into current approaches. Regarding, I would like just to mention two areas where OIE is currently concentrating its effort. Wildlife health. OIE, in a recognition that animal health, balanced ecosystem, and biodiversity contributes to achieving One Health, has developed a wildlife health framework in 2020, aiming at reducing the risk of disease emergence and protecting wildlife health. The framework overall goal is to protect wildlife worldwide to achieve One Health. It has two objectives, both towards OIE member states. The objective one states, OIE members to improve their capacity to manage the risk of pathogen emergence in wildlife and at the human-animal ecosystem interface, whilst taking into account the protection of wildlife. The second objective is about OIE members to improve surveillance system, early detection, and reporting and management of wildlife diseases. But how this objective will be achieved? I will say by focusing on three main outcomes. The first is strengthening multi-sectoral collaboration within a One Health approach and the capacity of management system. The second is the enabling environment, promotion of a policy, strategic and scientific environment that enables veterinary services and their partner to implement appropriate action. And finally, the third is the improvement of awareness and knowledge of risk and good practices in wildlife health management. Now talking about AMR in aquaculture. While we have limited data on the public health impact of antibiotic use in aquaculture, it has been suggested that administration of antibiotics in aquatic system can promote also the development of resistance. The OIE working groups for AMR, with the support of the Antimicrobial Resistant and Veterinary Product Department, are currently developing species-specific technical reference documents to be annexed to the OIE list of antimicrobial agents of veterinary importance. As you know, every year OIE is publishing this list of antimicrobial agents for veterinary importance. For aquatic species specifically, this task is undertaken by the OIE ad hoc group on technical reference for aquatic animals. This group is in the process of gathering information on antimicrobial agents authorized for use in aquaculture globally, specifically antibiotics used to treat bacterial infection in fish and crustaceans. As part of this information gathering, OIE collaborated with AU IBAR. As a matter of fact, it is AU IBAR who prepared a letter addressed to Chief Veterinary Officer and Director of Fisheries and Aquaculture, asking for their support. I think this will allow this group, the ad hoc group member, to obtain the needed information and have the delegated informed letter on this initiative. This is what I want to say regarding these two new areas OIE is focusing on. Thank you. Back to you, Chadia.
Thank you so much, Dr. Karim. It's really great to see that OIE is embracing those new areas of work on wildlife health and more focus on aquaculture and specifically on AMR issues. And we call on all our partners to collaborate with us to get this work further. I want now to go back to Dr. Yahya and with the difficult question that we are always being asked. You talk about the One Health, and it's an approach, it's a concept. So how to make it operational at the country level? How in reality it works? Do we have examples and success stories? And what are the challenges in make it operational at the country level? Over to you.
Thank you very much for this question that is really important. And I'm sure also that other colleagues from other sectors will tackle this issue because this is really a joint responsibilities. So we have this opportunity that member state, through the recommendation of the World Health Assemblies, are embarked in the implementation of the Global Action Plan. They are using the Global Action Plan on AMR to develop their national action plan in the context of the One Health approach. So I think this is really important at a country level. And also we need to recognize that there are links on the implementation of AMR with other existing initiatives and framework. I've already talked about One Health approach, but also the universal health coverage, the health security, including the international health regulation. So member states really need to continue to ensure coordination and enhance communication mechanism using not only different sectors, but also different disciplines. My predecessor has highlighted the importance of multi-sectoral and multidisciplinary coordination and communication mechanism. And this approach should not only focus on preparedness and response to public health, but also incorporate AMR. And member states need also to involve all relevant sectors for advocacy and resource mobilization to allow them to better implement the national action plan, as well as monitoring and evaluation using standardized tool provided by FAO, OAE, WHO, and UNEP. So I could say that significant progress has been made by member states. Already 30 countries in the African region out of 47 have they developed their national action plan in the context of One Health approach. And we have also 32 countries are now enrolled in a so-called GLASS, which is a platform that's to promote strengthening surveillance, collecting data not only for antimicrobial resistance, but also antimicrobial use. And all of this opportunity show that countries are doing a lot of effort in implementing national action plan for AMR, but still we have some challenges. For example, limited awareness and education on AMR, and also regarding the coordination, effort is really needed to promote coordination at relevant level in the spirit of One Health. And we could see also, despite that countries have developed the plan, we have still issue on better implementation due to lack of research. So it is important at country level to promote leadership and ownership so that they could further ensure availability of domestic funds for sustainability. Thank you.
Thank you very much. I know FAO is doing a lot on the One Health approach, especially at the country level, of course, with the collaboration with the partners. I give the floor now to Dr. Abdelhakim.
I would rather to go on what has been done, and I think Ali has alluded on the issue of the national action plans, and then also the platform and the engagement. I believe in actions, and I don't think that's enough. This is an issue that touches upon the lives of everyone today and our children in the future. And we really need to tackle it in a way, and we're lucky that we're dealing with a specific niche area on the misuse or the overuse of antibiotics. So it's either human medical doctors or veterinaries that we need to focus on to make sure that we raise the level, but we also need to support them by having the right legal framework. Countries have to really develop national standards of when and how and where to use every specific antibiotics and regulate that in a more specific and strict way. And I think that's controllable because that's not all in the hand of all the public. But we need to go also at the public level in terms of awareness. People, civil societies have a role, the governments and the media has a role, but we as a technical agencies need to help them on what the right message to disseminate. If we start with the schools, this nice video that was presented, Chadwick, if this can be provided in all local languages and disseminated and made available to schools and have just a session. Today we are gathering together. What worries me that all the experts on AMR are gathered here. They know what the AMR problems are and they know what could be the solutions. And we really need to, get the messages and awareness to those who don't know. And how do we reach out to them? So that I think remains very critical. If we have targeted, I don't know how many thousand schools today in Africa and say, this is the video, it's provided in your local languages. Please take out 5 minutes or half an hour to explain they would start building that awareness about the issue and they need to do something. National standards has to come in enforcement. And I think it's very important to regulate that misuse. Ali has mentioned the countries that have joined the National Action Plan. We work together with the WHO and OIE and now UNIT with the environment aspect on making sure that the countries adhere to the National Action Plan, which is a commitment from the governments and the countries towards achieving the One Health approach. So I think we're doing okay so far, but there's a lot that can be done more, and we really need to capitalize on these awareness weeks that come back every year into being more impactful. One last thing, building leadership at the leadership level in the countries on the specified ministries to be more aware of the impact of the issue is very important. And this is something that maybe we can collaborate with the other sister agencies to make it happen. Thank you.
Thank you very much. Very important areas you touch on, the ownership of the countries themselves of this AMR and how to develop the national action plans, how to finance it, most importantly, and implementing. And we will have a session specifically on this issue later in the week. We also talked about the regulation and the legislations, very important area. But again, how to enforce them in real life. And we will have a session led by FAO on this specific topics. I want now to ask Dr. Karim to also highlight from OIE perspective, how do you see the One Health approach operational at the country level?
Thank you. Thank you. I would like to compliment, to start by saying that when WHO adopted in 2015 its global action plan, then OIE, in support of that one, adopted in the following year in 2016 its OIE strategy on AMR. And really to make sure that the country are implementing at the very level. So in the strategy, we highlighted 4 main objectives, which will allow country really to make it operational. So the first objective, as my friend Hakim said, it is awareness, improve awareness and understanding. This is key. The second objective is to strengthen knowledge. To strengthen knowledge. To combat something, you have to know. To strengthen knowledge through surveillance and research. Research is vital because we need more maybe some replacement of antibiotics. If we have a replacement of antibiotics, then we will be more than okay. support good governance. Somebody talked about leadership. So support good governance and capacity building. This is the third objective. And the final one, the fourth one, is encourage implementation of international standards. If all stakeholders are implementing the standard, the approved standard, so then we will be sure that we will really come to the end of AMR. But to implement the strategy, the OIE provides guidance for the responsible and prudent use of antimicrobial agents in veterinary medicine with the aim of protecting not only animals, but humans as well as the environment. We cover all stages from authorization of these antimicrobials, from authorization, production, control, and distribution to use. We define also the respective responsibilities of the competent authorities and stakeholders. And this includes veterinary pharmaceutical industry, veterinarians, animal feed manufacturer, distributor, and food animal producer. In addition, for your information, in the PVS, the performance of veterinary services assessment tools of the capacity of veterinary services. In this tool, a critical competency is critical competency is dedicated to AMR. You see how AMR is important for OIE. And the OIE support individual member countries in the effort to implement the international standard regarding the use of antimicrobials. Chada was just talking about the legislation. I want to mention the OIE veterinary legislation support program, which was established in 2008 to help member countries recognize and address the need for modern, comprehensive veterinary legislation that provide the powers and authority necessary for veterinary services to carry out the key function in the veterinary domain efficiently to ensure public safety and promote the public good. Just for your information, AMR is not new for OIE. Since 1952, there was a resolution to talk about to fight AMR. So it is really not a new one. So back to you, Chada, this is what I can say about making One Health operational at country level. Thank you.
Thank you very much, Karim and our colleagues. You highlighted important areas, like we have a global plan of action, and then each agency, they have a strategy. We have it at the global level and at the regional level. We have also standards, guidelines, assessment tools, but then how to make it operational at country level and how to support countries to implement it. Thank you so much for providing this explanation of the different programs that can make this happen. Now, my last question, and maybe not the easiest, it's about how to build strong and sustainable partnerships for AMR, especially in our continent in Africa. So back to you, Ali. Maybe you can start off on this question.
Thank you very much for this important question, highlighting the importance of building strong and sustainable partnership. So to foster the One Health coordination, WHO is really engaged in multi-sectoral coordination initiatives. So we are promoting the tripartite plus, and we work closely with FAO, OIE, and UNEP. And also we are also working jointly with the Africa CDC, including the regional economic communities, as well as the civil society organizations. This allows us not only to promote joint coordination, as well as joint implementation on priorities activities in line with global action plans. And also we are promoting monitoring and evaluation using standardized tools. So WHO continue in order to combat AMR, to develop and support the implementation of policies, strategies, and guidelines, including tools. I have already highlighted the WHO Global AMR and User Surveillance System, the GLASS. And all these tools are used by member states to implement their national action plan. In the other hand, we are also providing technical support to countries in close collaboration with the partners that I have mentioned so far. And recently, we have trained 170 regulatory inspector from all the countries in our region on a way to integrate and also promote AMR prevention and stewardship strategies during the manufacture of antimicrobial product. And also I need to highlight that we continue to promote documentation for decision making, as well as advocacy for supporting countries to implement multi-sectoral coordination, including resource mobilization in close collaboration with OIE, FAO, WHO, and UNEP, as well as our colleagues from Africa CDC. Thank you.
Thank you very much. Due to the limited time, I will give the floor now to Dr. Abdel Hakim to provide us with the closing remarks from this session. Thank you.
Thank you very much, Chadia, and thanks to all the speakers. I'm really, really excited to see my old friend and good brother, Dr. Karim Tonkara.
Yes.
You asked a very important question about partnership. I would say partnership starts with, people getting to know each other, and I'll be very pleased to explore and working with Ali and Karim on making Africa a better place for its people and the future. This session is very important. The session tackles a very important aspect on adopting a One Health approach and multi-sectoral coordination mechanisms for the AMR. So that keyword of multi-sector is very important. This is, you're bringing everybody of the players, at least the key ones that are leading this globally, OIE, WHO, and FAO together to express their need. I see that our FAO strategic framework that talks about better nutrition, better production, better environment, and better health brings that One Health concept in that vision, which leads us towards the SDGs. And the same I see at WHO, OIE, as we move forward, we realize the importance of that coordination. I think the two major that we have a clear message to all the participants, and I hope this will go on YouTube to others to hear about the importance and the need to focus on the AMR side effects on the short and long term. What we can do, what governments need to do, and what is available. Ali mentioned the platform, the national action plans, and then also Karim mentioned on the need for research. If you want to tackle a problem, you got to know it first. And he really put his fingers on the issue. You need to invest also in research to understand it better so that you provide better solutions. We spoke about the need for legislations, legal framework, but more importantly, enforcing them and building awareness at the level of the technical people, veterinarists and medical doctors concerned with all this. I think those are key, I would say, messages that came out of this one. We at FAO will continue building partnership. Partnership is, and we call it partnership for impact, because now we have a clear target. We have a goal that we are trying to achieve. We're not partnering because who want to sit together and be nice together and have coffee together. We have a joint mutual goal to achieve. And I think that remains very important. We should not forget that there are other stakeholders we need to bring them along. At the country level, all the civil societies, the private sector, the research and academia, we have to bring them along, empower them, and make sure they do their role in dissemination of the messages and the knowledge and the actions. Thank you very much, Shadia, for moderating this session. And we thank all those who have been here listening to us today. And we definitely thank the Dr. Karim and Dr. Ali Yahya, the speakers. And we are available, and thank all those who are supporting us at the back with the interpretation. Apologies, we're speaking a bit fast, making their task a bit difficult. Thank you.
Thank you very much, Dr. Abdel Hakim, for closing this sessions. And I just want to highlight that through this session, we set the scene for the whole week to come. And now I am very pleased to hand over to my colleagues in WHO to provide us with more information about how national action plans are implemented and financed. Thank you so much. Over to you, my colleagues in WHO.
Thank you. Hello and welcome to this session where we'll be discussing the implementation and financing of antimicrobial resistance national action plans. My name is Effie Mpande. I'm your moderator for this session and would like to sincerely thank the discussion as interactive as possible. So please feel free to submit your questions in the chat box. At this point in time, I would like to introduce our esteemed panelists. On the panel, we have Honorable Kweku Ajmamenu, Minister of Health of Ghana. We also have Dr. Abebe Haile Gabriel, who is an Assistant Director General and Regional Representative for Africa at the Food and Agriculture Organization of the United Nations. We also have Dr. Rashid Bogedu, who is the Sub-Regional Representative for North Africa at the World Organization for Animal Health. And lastly, we have Dr. Juliette Bayo Godenopo, who is the Director and Regional Representative for Africa, UN Environment Program, UNEP. Welcome. So we'll go straight to the questions. What is the role of your respective institutions in supporting investment and financing for antimicrobial resistance? We will start with Honorable Ajmamenu, the Minister of Health of Ghana. Over to you.
I think he is having trouble connecting. Maybe we can move to the next speaker.
Okay, let's move to the next speaker, who is Dr. Haile Gabriel. Dr. Gabriel, over to you.
Thank you, Madam Moderator. Can you hear me?
Yes, we can hear you. Thank you.
Okay. Honorable Minister, Excellencies, colleagues, distinguished participants, let me start by thanking the organizers of the WAAW campaign for Africa for bringing us together in this important event, and for also inviting me to speak at the panel on the implementation and financing AMR national action plans. We just had an exciting, very excellent panel, also joined by my colleague, Dr. Abdel Hakim. It's an honor and pleasure for me to be part of this exciting and important initiative, also once again representing FAO. Now, the Africa level theme for 2021, AMR governance, preventing AMR is our shared responsibility, speaks closely to what Africa upholds. And this is a value of shared responsibility. Without further ado, let me speak to the questions related to implementation of AMR action plans and that of financing, including what FAO does. Now, I think the good starting point would be to ask, where are we in terms of status of implementation of AMR action plans in Africa? Since the launch of the Global Action Plan in 2015, we know that well over 100 countries worldwide have developed AMR national action plans. Now, in fact, FAO will be launching the second AMR action plan for the period covering 2021-2025 this month. The plan is aligned with the Global Action Plan and aims at supporting AMR mitigation in the agri-food system. The good news is that there has been a wealth of normative guidance from the tripartite agencies, namely FAO, OIE, and WHO, and the Codex Alimentarius to support implementation of the action plans. In Africa, if you look at the progress in Africa, as of February 2021, 43 countries, and this is 80%, have developed their national action plan with technical validations. Of these, 21 have their national action plans approved by national authorities, which is a sign of political commitment. However, it's noted with concern that all AMR national action plans reported low levels of implementation. And this is on all key action areas, on awareness raising, on surveillance, on governance, including regulatory framework, and implementation of good practices. This is not good news. There are several reasons mentioned that have contributed to the low level of implementation of the national action plans, including, first, lack of prioritization of the activities themselves. Now, there are, on the one hand, ambitious national action plans for 3 to 5 years with extensive financial resource requirement, but these resources have not been available at country level. There have been also significant deficits in existing infrastructure, including laboratory infrastructure and limited human resources capacity, such as dedicated staff, including limited laboratory skills to conduct AMR and antimicrobial usage, AMU surveillance. Of course, we have questions. There are questions over the adequacy of political commitment itself, which has not translated into adequate allocation of resources to address AMR challenges. Also on the appropriateness of the existing governance arrangements and systems. For example, in many cases, One Health coordination mechanisms are found to be inadequate across the sectors. Similarly, important gaps in regulatory frameworks are prevalent. Obviously, lack of sustainable financing mechanisms at the national level and dependence on external funding, which are not reliable and sustainable. Now, what does it take to improve the situation, to improve implementation? And I just want to focus on 2 key areas. One, improved governance. I think the first panel has really addressed these issues. And the second one is on sustainable funding. To improve AMR governance, leadership is going to be key. Stronger political leadership is required for advocacy, for coordination, most importantly for accountability. These are all needed to enable a sustained One Health response to AMR. Second, the analysis of country experiences suggests that having an effective multi-sectoral engagement within the government and coordination mechanism is very strongly associated with progress in implementation. And we need, so this is an evidence. Third, engagement of all stakeholders. And this is not just government sectors, across the human, the animal, the plant, the food, the feed production and environmental sectors, based on a shared vision and goal to accelerate the development and implementation of the national action plans. And finally, the importance of context-specific approaches. One size does not fit all, and approaches need to be sensitive to specific contexts and needs to be integrated with broader governance structure. On financing, it is a priority. Is it a priority in the development agenda? You know, before we speak about financing, is it a priority? First of all, we need to establish that. So budgetary allocations follow prioritization. And countries need to identify AMR response in their national priority sectors. And it should be co-owned among key sectors. It should not be left to any particular sector within the government. We need to be also opportunistic in terms of mainstreaming AMR into already funded activities for SDGs. This is one way to mitigate AMR and consolidate country efforts. Of course, we need to promote it as an investment that can pay off with a positive payoff, with positive returns. And therefore, advocacy for increased public and private sector investment to combat AMR needs to be based on that. Frame AMR as an investment issue with a strong business case. We need evidences and analysis to demonstrate its rate of return in terms of economic returns, social returns, environmental benefits. Hakim mentioned about the value of research. This is important because it changes the narratives and the shapes the dialogue with key stakeholders. Ministers of finance will be more interested to know what they can get from allocation of additional resources to support AMR action plan implementation. So we need to speak their language. And the same is true for other stakeholders, be it private sector, banks, and so on. And so we should make a strong case for increased support for new and existing funding mechanisms as well. Now, FAO and partners' responses to the challenges of AMR action plan implementation. FAO has developed an AMR progressive management pathway, for short PMP. It's a tool to evaluate the status of implementation of AMR National Action Plan and support for better operationalization. Remember, I emphasized on accountability. You can strengthen accountability if you have data, if you can monitor. I think somebody, okay. Secondly, funds from FAO regular program, because you asked how FAO is supporting also financially. FAO is not a financial organization, but from its regular program and projects, FAO has been supporting the development and implementation of AMR national action plans in various countries in Africa, in all countries, in all regions in Africa, using our different funding mechanisms in partnership with the resource partners. And of course, the international and African coordination mechanism on AMR has been put in place by the tripartite, including FAO, WHO, OIE, but also UNEP, the African Union, and other partners and regional economic communities, which aims to collaborate, optimize, and mobilize resources to support countries. Last year, you will remember during the WAAW 2020, the African regional directors and representatives of the tripartite signed a joint communique to support AMR mitigation on the continent, including to foster the One Health multi-sectoral collaboration and support member states in developing, reviewing, updating, and implementing national AMR action plan in line with the One Health approach. So this is, in short, what I would like to say, I would like to mention at this stage. Thank you for the opportunity, Princess. You are muted, Princess. Moderator, we don't hear you.
Thank you, Dr. Gabriel. We now move on to, thank you for your informative and insightful response. We now move on to Dr. Rashid Bogedo. Dr. Bogedo, what are your thoughts?
Thank you.
On the role your institution is supporting investment and financing for antimicrobial resistance?
Thank you. Thank you very much. As already said, antimicrobial agents are essential to ensure human health, animal health, welfare, and food security. Therefore, the human, animal, and plant sectors have a shared responsibility to prevent and minimize development of antimicrobial resistance. The OIE is supporting veterinary services of member countries through the development of intergovernmental standards on IMR. Through these standards, the OIE promotes the responsible and prudent use of antimicrobial agents in terrestrial and aquatic animals, so as to preserve their therapeutic efficacy and prolong their use in both animals and humans. It has developed intergovernmental standards on IMR and on the monitoring of the quantities of antimicrobial agents used. In addition, in the framework of the Global Action Plan on Antimicrobial Resistance, the OIE, supported by FAO and WHO within the tripartite collaboration, has taken the lead to build a global database on antimicrobial agents intended for use in animals. That is crucial to monitor the efficacy of the control measures implemented through the national action plans. In fact, the database is designed to monitor the type and use of antimicrobial products, support member countries in implementing international standards, measure trends over time, trace circulation and use patterns globally, evaluate the quality and authenticity of microbial products in use, and the OIE publish an annual report on the use of antimicrobial agents intended for use in animals. And very interesting, the latest report was published in April 2021, providing annual data collection on the use of antimicrobial agents in animals. Contribution to the OIE database increased from 130 participating members during the first report in 2016 to 153 participating countries for the latest report. And now we have 156 OIE members, because we have three others, one no contiguous territory of one OIE member and three non-OIE members, but to contribute in our database. And recently, the OIE conducted also surveys in Africa and other regions on antiparasitic agents, because there is another concern, and resistance in terrestrial and aquatic animals, and on responsibility for the prudent use of anthelmintics with the aim of making the state of play of the situation and address gaps. Thank you.
Thank you, Dr. Bogedo, for that informative and insightful response. We move on to Dr. Kodenopu. Dr. Kodenopu, what is the role of your institution in supporting investment and financing for antimicrobial resistance? We seem not to have Dr. Juliette Kodenopu.
No, I think only Dr. Abibi and Dr. Rashid with us.
Oh, thank you. Thank you, Dr. Claudia. Okay, so how are your respective institutions, how can your respective institutions work with governments to ensure effective implementation of antimicrobial resistance national action plans. We'll start with Dr. Haile Gabriel. Over to you.
Thank you, moderator. I thought our initial response was guided by these very questions that you have asked. But again, it is very important. As far as FAO is concerned, whether it is for AMR or for any other priority initiative, we collaborate with member states to support the implementations of priorities identified by themselves. That's why if you have followed my initial reaction, I emphasized on the priorities. The starting point is for governments, for national governments to prioritize AMR. And we have been supporting several countries in Africa in the development of the national action plans on AMR. So the priority is very important because the other things will follow. Of course, FAO provides, based on its comparative advantages, a lot of technical and normative support, providing guidances, data, evidences, and also drawing from global best practices to inform the development and implementation of national action plans. And we have a lot of examples in this respect. FAO also works with member states in mobilization of resources, including financial resources, to support the implementation of the AMR national action plans. So the first point we want to emphasize is in the countries, FAO develops together with the member states what we call the country programming framework that prioritizes what each country wants to do in collaboration with FAO and using FAO's networks. And what we have been encouraging member states is to make sure that AMR has been identified among the priorities within the country programming framework. And of course, FAO is not alone in this. Together with the tripartite, the OIE, WHO, and others, we have been working together with the African Union. We have been supporting this effort. Over to you.
Thank you, Dr. Gabriel. We have a question in the chat box. How can young antimicrobial resistance champions be supported to increase awareness of antimicrobial resistance? This question will give it to Dr. Bugedo. Dr. Bugedo, over to you. Would you love to respond to the question in the chat box?
I don't know if this question is for me. It's not sure. Maybe it's for the panel first, because the question is for the champions.
Or the earlier panel, okay. Okay. There's another question in the chat box. I know Dr. Haile Gabriel already responded to some of the challenges in implementing national action plans. Perhaps Dr. Bugedo, you can respond to this. What are the key challenges in implementing national action plans?
Yes, how can we strengthen stronger partners with CSO, young people, and government, including passion groups, to implement? Yes, okay. Thank you. Do you hear me?
Yes, yes,
Okay,
we can hear you. Thank you.
The success against antimicrobial resistance can only be achieved when the public veterinary and environmental health authorities put these global strategies into place at the national level. It's very important. For example, the National Animal Health Services implementing the OIE's intergovernmental standards means, first, the presence of adequate legislation on the use of antimicrobials. Second, veterinary profession, which is well trained and supervised by law. It's important. And third, the allocation of the necessary resources to strengthen veterinary services so that they can exercise the appropriate controls and surveillance. As for today, 21 countries, as said before, in Africa have developed and officially approved national action plans on antimicrobial resistance, of which 4 in North Africa, in my sub-region, Egypt, Libya, Morocco, and Tunisia. Therefore, I think that experience and the lesson learned from first round of implementation of MPTF program, it's a new program, it's very interesting, will be very important for guiding other countries in the implementation of the National Action Plan and continuing to mobilize financial resources to facilitate and encourage countries to implement their National Action Plan. This is my response. Thank you.
Madam Moderator, may I come in?
Thank you, Dr. Bogedo. Yes, please, though we are in the dying minutes of the session. Please go ahead.
Yeah, I
yes,
see.
Yes, please go ahead,
yes,
though we are almost coming to.
Okay, no, it's because there are some comments I read from the
chat box.
Yes, like how can efforts on AMR containment from private sector be considered at a higher level? How can the use be, engaged and so on? Most of the discussion I observe is focused on supply side issues. Of course, supply side issues are very important. Myself, in outlining the challenges, focused mainly on the supply side of the problem. But the demand side of the problem also needs to be understood. What is the incentive? It's not like somebody is going to give all the solutions. You know, we are talking about people being at the center of this. So how do they also contribute to the solution? What are the incentives? That's why in my earlier remarks, I wanted to link it with considering AMR challenge as an opportunity for investment. Does it have a rate of return, or is it just a cost? I believe we can convert it into also benefits. There are social benefits as a result of prevention and mitigation of AMR. We need to quantify that and speak the language of investment. Otherwise, continuous dependence on donations is not going to work. That's why the role of private sector is going to be very important. And as we know it, private sector, they don't just invest for nothing. Thank you. Over to you.
Thank you, Dr. Gabriel. And thank you for highlighting how challenges in National Action Plan implementation can be addressed. We are running out of time. May I quickly ask you to have your closing remarks under 30 seconds. We'll start with you, Dr. Gabriel. Then
okay,
we move to...
Thank you so much. It's just 2 points. One, for a successful AMR response, we need leadership. We need leadership, and that has been missing. I think we need to be very, very, very clear. Secondly, it's not any one particular sector's agenda. It must be co-owned, it must be co-led, multi-sectorally, and therefore they need a lot of the need for coordination. Third, we need multi-stakeholders engagement. It's not the business of government only. It requires all the actors along the whole spectrum. And fourth, the dependence, the continuing dependence on external funding is not going to be sustainable. We need to make a business case from out of the AMR investment. Thank you.
Thank you. Dr. Bogedo?
It's me, maybe.
Dr. Bogedo, your
Yes.
closing
Thank you.
remarks?
Yes, thank you. Thank you for this opportunity for us to discuss about this very important concern. And I'm sure that the tripartite plus, because now we have with us our colleague of United Nations Environmental Program with the FAO and the WHO. And I'm sure that the human, animal, and plant sectors have a shared responsibility to prevent and minimize development of AMR. Strong collaboration between WHO, FAO, OIE, and UNEP was put in place as tripartite plus framework to share responsibilities and coordinate global activities to address health risks at the human-animal ecosystems interface, including AMR. It's very important to help member countries to build, to set up all national action plan on the field. It's very important. Over to you. Thank you.
Thank you. As we come to a close of this session, I'd like to thank you for highlighting country leadership and the commitment for sustainable action, and also the need for One Health approach, which is key to addressing antimicrobial resistance. Then I would also like to thank you, Dr. Haile Gabriel and Dr. Bogado, for your valuable contributions. I would also like to thank the participants for your participation. Remember, it is our responsibility to end antimicrobial resistance. I've been your host, Effie Mpande. Goodbye.
Thank you, Effie. Thank you so much. Now we move to the panel 3 to be moderated by our colleagues from FAO, Dr. Tabitha Kimani, and the panel will be on regulation and legislations relevant to AMR. Over to you, Tabitha.
Thank you very much, Chadia. Good morning, good afternoon, good evening, depending on where you're joining from. My name, as Chadia said, is Tabitha Kimani, FAO, moderating from Nairobi, Kenya. I'd like to first introduce the panelists, and the first will be Dr. Yabanga, Burkina Faso's Minister of Animal Resources and Fisheries. We also have in the panel Dr. David Firi, FAO Sub-Regional Coordinator for Eastern Africa. We also have Dr. Ahmed, WHO Regional Director for Eastern Mediterranean. And also, last but not least, Dr. Samwa Kusama, OIE Sub-Regional Coordinator for Eastern Africa. Welcome, panelists. And I'd like to advise the participants that kindly keep the questions in the chat and we will answer them time allowing. So I'd like to first invite the minister. Is the minister with us? Minister Burkina Faso, are you with us?
Oui, bonjour. Oui.
Thank you very much.
Bonjour tout le monde. Je suis Dr.
Yes, good morning, everyone. My name is Dr. Tengwande Yabanga, and I'm the Animal Resource Minister of Burkina Faso.
We will start with you. As a minister, you are in charge of policy making, including legislation. And as you have heard, this session is on legislation and on AMR. We would like to hear from you. What is your view about the best approach to regulating AMR? Over to you.
D'accord. Merci beaucoup.
Thank you very much. First of all, on behalf of the government of Burkina Faso, I wanted to thank you for giving me the floor or the possibility to discuss about the antimicrobial resistance. As you know, is a current issue considering the impact of this antimicrobial resistance in regards to animal health as well as human health. Now, to answer your question, I want to say that the rise of antimicrobial resistance and the absence of new antimicrobial affects every stakeholders. Therefore, we need to change our habits in terms of antimicrobial use. Indeed, human animals' use of antimicrobial increase the resistance of antimicrobial and is crucial for us to deal with that issue in various sectors of activities. Therefore, we need to develop directives to improve the use or the better use of antimicrobial in order to tackle that issue. This tool will allow us to involve efficiently various actors to implement the multi-sectorial plan to tackle the antimicrobial resistance. As a result, we will be able to improve the health of everyone. Therefore, the implementation of these guidelines will help us to deal with the antimicrobial resistance. There are some aspects we need to consider. It has to do with the use of antimicrobials, so we need proper approvals. Therefore, we also need professionals to treat some diseases. When it comes to prescriptions, we need a proper referral. We need to take into consideration the classification of antimicrobial developed by the competent agencies to be able to avoid any misuse of antimicrobials. We also need to have guidelines for better use of active components, pharmaceutical components of these antimicrobials, and various actors within the supply chain must be sensitized. And I believe that once we'll be able to abide by the guidelines of the standards, we'll be able to tackle once for all the antimicrobial resistance in our various countries. Thank you very much.
Thank you very much, Dr. Yabenga. You have highlighted that we need legislations for approvals, for prescriptions. We also need legislation for classification of antimicrobials, and we also need guidelines on use of antimicrobials. Now, David, I will come to you for the same question. How best do you which is the best approach according to you to improve, to develop AMR, to regulate AMR? David, over to you.
Thank you very much, Tabitha. I think great question, answered, I think, quite well by Excellency the Minister there. I just wanted to, before I come directly to a question, to point out the fact that legislation, I think, plays a very key role in helping curb the development and spread of antimicrobial resistance in order to address the abuse, overuse, misuse, and release of antimicrobials into the environment. We believe legislation, and this is, I'm talking for the tripartite, FAO, WHO, and OIE, legislation is critical to give sustainability to policy objectives and also to clarify roles and responsibility, but also create concrete obligations for the different stakeholders and also ensure that those obligations and those responsibilities are enforceable. We do not believe that there is need in particular to develop a separate legislation on AMR, important as it is, because all regulatory frameworks already exist in different stages. And I think it's important because Abebe mentioned this area, Abebe Haile Gabriel mentioned this area about the importance of coordination. So to answer your question directly, Tabitha, let me mention that we believe that AMR requires a One Health approach where all the relevant sectors are involved. So again, that coordination element. Also the strengthening of sectoral legislation across all areas relevant for AMR. The reason why I mentioned earlier that we do not need separate legislation is that legislation does exist from different angles, whether it's from the animal health, from human health, or from the environment health side. But there's very little coordination between these sectors to make this work. And hence the importance, I believe, of strengthening sectoral legislation and coordination across all the areas relevant, which requires, therefore, a setting up of an institutional coordination mechanism to support that cross-sectoral coordination that I was talking about. So to have all these different sectors work as one, at least with respect to One Health aspects. Also, I believe that it is important to harmonize where possible the existing laws in the different sectors to ensure legal consistency across the sectors, whether I'm talking of human health, animal health. By animal health here, I'm talking of both on land, terrestrial or aquatic animal health, plant health, veterinary medicine, products, feed, pesticides, food safety issues, environmental protection, as well as water protection. As I said at the beginning, there's a tendency to have different laws, different legislative mechanisms in different sectors. That those laws exist. The problem is that you cannot be sure that there is consistency among these laws. So that's what you need. That's why it's very important to have this consistency among them and to make sure that there's good coordination. And the legislation, I repeat, already exists. It's not implemented as well as it should be, but then it's not also coordinated. I will stop there for now, Tabitha, and back to you.
Thank you very much, David. You have mentioned the issue of sectoral legislations, multi-sectoral legislations, coordination, harmonization to ensure there is consistency and coherency among the legislations. And these legislations need to address multiple areas. And then we don't need new legislation because we don't need AMR specific legislations because we have different pieces of legislations in different sectors. So Samu Akusama, I'll come to you with any additional inputs on this issue on how best to regulate AMR. Over to you, Sam.
Okay, thank you very much, Tabitha. As my colleagues have said, there are already instruments in place to actually regulate legislation. But I just want to emphasize that it's important to know that legislation is the powerful tool to mitigate in the AMR processes. Therefore, actually, we also need to have comprehensive reviews of the existing legislation around the regulation of antimicrobials in all relevant sectors, with actions to identify and fill gaps and harmonize the various separate laws that may be more productive approach to addressing AMR mitigation processes. And as my colleagues have said, a holistic approach is actually the best way we can address this. Now, the AMR governance is essential, therefore, to promote the sustainable actions that will include proper institutional collaboration from the public and the private sectors to meet the dynamic societal demands on the continent. Now, how can we support the regulating the AMR mitigation processes? First of all, at the international level, we have got standards. And if you borrow from the OI, if I can tell you from the OI perspective, we've got international standards on prudent use of antimicrobials, which provides guidance to member countries on the responsible and prudent use of antimicrobials. And countries can draw to this to actually develop their national regulatory processes. At the regional level, we have got instruments that have been developed by different countries, like the mutual recognition procedures for the registration of drugs and even vaccines. And there are good examples to draw from here, like in the East African community area. And of course, as I said, all these can support the national laws and regulations to commit them further to help actually improve the implementation. Now, implementation is something that actually it lacks in most of the countries. We may have very good regulations and legislation, but how to implement is really the problem. But also to help actually in the processes, we have got tools like the veterinary legislation support program, which my colleague talked of earlier in the first panel, that actually offers comprehensive review of to modernize the veterinary legislation with regard to all aspects that may be required, including AMR. Now, to encourage implementation of international standards, the OI can actually support member countries in their effort to implement standards and disseminate to encourage adoption of the recommendations and strengthen multilateral support and build on the successes that have already been there. So these are actually some of the highlights on how the regulating the AMR mitigation process can be supported. Thank you.
Thank you, Sam. You bring additional contribution in terms of international and regional standards that are already in place and the tools that OIE has available to countries to best regulate AMR. Dr. Ahmed, I will come to you now, and if you have any additional inputs into best approach to regulate AMR, and you can combine this together with something that David has already introduced, that there is need for an institutional coordination mechanism for legislations to for legislations to work in countries. Over to you, Dr. Ahmed.
Thank you very much for coordinating this important meeting, and it is my pleasure to participate with dear colleagues. In fact, they have mentioned all essential elements relevant to this important topic. Answering your question, I may say that when it comes into the best approach to regulating AMR mitigation processes, the first thing and the most important thing that I think we need to do and to have is that governments collectively should approve their multi-sectoral AMR national action plans, as have been mentioned by previous speakers, as well as provide adequate resources. That includes financial and staff to implement and monitor prioritized activities in each sector engaged in implementing that national plan. And I feel this is what is lacking, in fact, in many of the countries that are suffering from this aspect. At the same time, governments should ensure, like, creating links between AMR mitigation and existing health policies and strategies. Like, for example, we all talk about universal health coverage, primary healthcare systems in general, strengthening. We talk about environmental health. We all talk about food safety, emergency preparedness efforts, single disease initiatives, like, for example, HIV, TB, malaria, and you name it. So I think we have to have that sort of link between these different important programs. The third point that I feel that is adding to the best approach is developing and enforcing, as have been mentioned by my colleagues, regulation on prescription only sales of antimicrobials, as the overuse and misuse of antimicrobial remains the main driver of AMR based on several studies that have been done. And this is also what is lacking in many of the countries. Creating these rules and enforcing them will definitely help. And we have many successful examples, countries that have followed that. Regarding the mechanisms for institutional coordination on AMR, as you have mentioned, adding to what my colleagues have already spoken about, governments should establish an AMR multi-sectoral coordination mechanism at the national level with strong leadership and accountability. Without this stronger leadership and accountability, we will be facing a lot of difficulties, especially if each government body or non-government body having a role to play on this important topic, working in silos, we will not be able to move one step ahead. In addition to that, to the strong leadership and accountability, we have to have, this strong monitoring hat to make sure that we are progressing well based on the action plans. And the second point on this issue, that given that AMR response at the country level requires action with various sectors, as we all know, including, human health, animal health, agriculture, environment, education. So therefore comes the effective coordination and governance across these sectors through a multi-sectoral government mechanisms, as have been mentioned by my colleagues, as well as within sectors, within each sector, like health sector, agriculture, animal sectors, and across departments within these sectors. Leadership skills are highly needed, to enhance such concept, to equip those leaders at different levels with the knowledge and the skill to move forward and implement, for which in WHO, collaborating with many other UN and then non-UN organizations, have developed training courses and capacity building in order to make sure that we have strengthened the effective communication and coordination within these sectors. And in fact, we are preparing now for a global meeting that will be hosted hopefully next year by Oman in close coordination with key players, global key players, and headquarter with the regional office is working with the country office to make sure that that meeting will be attended by key active players on this regard. So thank you very much for this chance, and I hope I managed to answer your questions. Back to you.
Thank you very much, Dr. Ahmed. You have brought in new dimensions in terms of, linking the AML NAPs and policies to other programs and policies within the health sectors and the agriculture sector. So thank you very much. Now we will do one final round of questions. And please take 2 minutes to answer this question. And we will start with the minister, then we go to FAO, to OIE and WHO last. We would like to hear your thoughts on how can we improve implementation of legislation at national level. And you can see already in the chat, this is coming out that it's a weakness. We have legislations, but we have poor implementation. How can we improve implementation? Over to you, Minister.
Merci. Alors, donc, je pense que...
Thank you very much. I think that you want to know how we can improve the implementation of legislation, and many people said we need regulation, a proper law. We need to define roles and responsibility of every stakeholders. We need the coordination within the various sectors involved. But as people said, the initiative of FAO, of human health, animal health, in regards to the approach, the One Health approach, we need to work in order to mitigate the impact of antimicrobial resistance. And I believe that this this platform is quite successful, and in Burkina we have a platform and we discuss of that antimicrobial resistance, and there is also a network of laboratories to deal with to do various labs, various steps, various tests, and the results of these tests as a source of information. So it's true, we need regulations, we need to a better coordination, but I think that we have to emphasize and sensitize the various actors, the various stakeholders on the consequences of the misuse of antimicrobials. We cannot use it every day, and sometimes to get new antimicrobials, it may take several years to come up with new molecules and efficiently treat new cases of diseases. Therefore, I think that we need to redefine the responsibility and roles of various stakeholders, and we can work on that One Health platform to sensitize the stakeholders. And I think that everyone is responsible, no matter if either the industry, producers, suppliers, or doctors. So everyone needs to be involved, needs to be informed, and there are some requirements to make sure that that One Health approach is a success. We need the proper information on molecules. We need to know the type of disease, and based on these new reforms, we will be able to improve the implementation of regulations. Thank you very much.
Thank you very much, Minister. Over to you, David, 1 minute.
Thank you. I will try to be brief. I think Lali Ziras of WHO summarized it very well in the chat. The weakest link in regulation of antimicrobial resistance is the enforcement of the existing guidelines. Without addressing functionality of enforcement institutions, the regulation will remain weak and will continue seeing widespread resistance. So let me say that I think we need very good awareness and advocacy at all levels. Strong political will is essential to move the antimicrobial resistance work forward. Strengthening the role played by the environment team is extremely important, and I wish we had UNEP here. I thought we did. It's extremely important that we have environment with us, because you cannot have One Health with only talking of human health and animal health. The environment is especially important. But then also the empowerment of the law enforcement units, whether it's training, but also you need human and financial resources to make this work. But the most important of all is the commitment of governments to make this work. So I would say, if there was one thing that I was going to say, the strong political will to implement. Thank you, Tabitha. Back to you.
Thank you. Strong political will is the most important, as mentioned by David. Over to you, OIE.
Yeah, thank you. Thank you, Tabitha. I'll reiterate what David has just said, that it's important to have animal health, plant health, and environment being addressed together, because there's a clear interactions among these sectors that contribute to the development of antimicrobial resistance. And therefore, if we wish to improve on the implementation of legislation on antimicrobials, we actually need to identify gaps in the existing laws. And these laws may already actually be containing effective measures for the proper regulation and production, distribution, and use of and disposal of the antimicrobials, and may well mitigate AMR, even if AMR is not specifically mentioned in the legislation. So we need to look at all those legislation, identify where the gaps are. Now, we also, to help improve in the implementation of legislation, we need to address AMR governance, because enforcement of rules and standards will be an effective tool to fight AMR, and governance becomes very important. Now, using a One Health approach is one way to help actually countries to improve implementation and legislation, in addition to adopting international standards developed by the tripartite. I would like just to emphasize saying that when legislation is developed, there should be consideration given to ensuring that the necessary mechanisms and measures for effective enforcement are in place, or the law will just become a paper tiger if there are no instruments in place to enforce it. Thank you.
Thank you very much, Sam. Dr. Ahmed, one last thought, 1 minute.
Thank you very much for this important question. 3 points that I'd like to raise and add to what my colleagues have mentioned. Number 1, establish a monitoring and evaluation framework for the AMR national action plans, as well as systems to monitor progress, annually in the implementation of the various regulations to address this AMR. Otherwise, again, I must say that otherwise we will not be able to check where are we heading and where to redirect ourselves. The second point, engage all ministers at the highest level to monitor progress, and engage public-private sectors as well as civil society to strengthen the dissemination of the regulations and advocacy for such regulations to make sure that it is implemented at its maximum level. The third and the last point is creating and developing and making sure, disseminating an awareness raising program of all stakeholders to drive behavior change of the various stakeholders to reduce inappropriate demand, enforcement of the implementation, of these regulations, as well monitoring with the data from the field. So these are the 3 main points that I'd like to add to what my colleagues have mentioned. Thank you very much. Back to you.
Thank you very much, Dr. Ahmed. We have run out of time. I think I can summarize what we've had. We've heard that we need a One Health approach to legislation. These legislations are in different sectors, so the gaps needs to be filled in each sector. They need to be coordinated. They need to be, coordinated so that there is coherency. They are speaking to each other. There is no conflict. We need institutional mechanisms to coordinate the implementation of these legislations. We need political will. We need awareness, first of all, about the legislations that are in place. We also need political will. And as one of the participants have written on the chat, political will is not about signing. It's actually about, allocating resources, actions to the words that have been put there. And then finally, we need awareness, we need political will, but we also need capacity development for the institutions that are implementing these legislations. We also need to monitor and regulate these legislations. I'll also conclude by saying that all those countries that need to update or review your legislations, as OIE has mentioned, in addition to the OIE regulatory support program, there is a joint tool that is being developed by the tripartite, plus including UNEP, a One Health legislation assessment tool that will be available for all countries to assess, to do a One Health legislation assessment. And with that, I thank all the panelists. You have done great, and thank you to all the participants for listening and putting in your comments in the chat. And we say goodbye and hand over back to you, Chadia. Bye, everyone.
Thank you very much, Tabitha. Thank you to all the speakers. Great interventions really about this important issue of legislation and regulations. Now I hand over to my colleague, Dr. Wendy Alimi from Africa CDC to take us through the Africa communique on antimicrobial resistant governance. It's developed and signed jointly.
Hello, good afternoon. Hello.
Sorry.
Hello.
It's developed and signed jointly by the regional directors of the regional organization, the tripartite, FAO, OIE, WHO, and also UNEP, African Center for Disease Control, and the African Union Inter-African Bureau for Animal Resources, EU IBAR. Over to you, Wendy.
Thank you very much, and good morning, good afternoon, distinguished delegates and colleagues, depending on where you're joining us from. On behalf of our organizations, I'll be presenting the regional communique. So this regional communique is the second regional communique coming out of the African continent. It is led by the leadership, the regional directors of the Africa Centers for Disease Control, AU-IBA, both on behalf of the African Union Task Force on AMR, as well as the Food and Agriculture Organization of the United Nations, FAO Regional Office for Africa, FAO Regional Office for Near East and North Africa, WHO Regional Office for Africa, WHO Regional Office for Eastern Mediterranean, World Organization for Animal Health Regional Office for Africa, and the United Nations Environmental Program and Regional Office for Africa. Our leadership has committed and is committing to strengthening and accelerating implementation of previous commitments to tackle AMR, including relevant resolutions of the governing bodies of the African Union, the tripartite, FAO, OIE, and WHO, and UNEP, and other relevant agencies, and AMR multi-sectorial national action plans. Through the leadership of our organization, we commit to subnational level to ensure successful governance of AMR by supporting robust institutional arrangements in both public and private sectors, and developing and enforcing appropriate regulatory frameworks. Thirdly, there's a commitment to foster the One Health multi-sectorial and multidisciplinary coordination and collaboration, as this is the best approach to leveraging our comparative mandate and strengths to effectively combat AMR on our continent. Our leadership commits to continue to support African member states to address the growing global threat of AMR through developing national multi-sectorial AMR action plans in line with the Global Plan of Action, and urges that these national action plans be fully funded, implemented, and evaluated. The leadership of our organizations commits to developing and implementing a comprehensive and coordinated regional advocacy and communication strategy to tackle AMR by increasing awareness, understanding, and encouraging behavior change through evidence and sharing of best practices and scientific knowledge. Understanding that there is also a need to engage academia, research institutions, private sector, civil society, and the media. Maintaining and strengthening appropriate stewardship of antimicrobials, including through infection prevention and control, water, sanitation and hygiene, biosecurity measures, routine immunization, and advocating for equitable vaccine access to prevent infectious diseases such as COVID-19. The leadership of our organizations commits to maintaining and strengthening good agriculture and food safety practices, including safe processing, animal vaccination, and farm biosecurity, as well as farm waste management and controlling infections in the agriculture sector. Committing to integrating AMR in all efforts and programs for epidemic and pandemic prevention, preparedness, and response. Health system strengthening, animal and environmental health, infection prevention and control, water, sanitation and hygiene, and in sustainable food systems, food security, and food safety. Lastly, our leadership commits to evaluating implementation of all of this commitment on tackling AMR through the ongoing work of existing governance mechanisms of the African Union, the regional tripartite, and UNEP, and sharing lessons learned, best practices, challenges, and opportunities. So thank you very much. And this presentation was made on behalf of all of the organizations represented here. Over to you, Chadia.
Thank you very much, Wendy, for this. The communique will be issued later today, and we have also a press release accompanying it, and we will share it with all the participants on this webinar. Now I would like to share with you an overview of the events during the week following today. So just to share my screen, 1 minute. So for tomorrow, we will have a session on regulation and legislations relevant to AMR, coordinated by FAO and OIE. And as Tabitha said in her closing remarks, we have a One Health AMR legal assessment tool that we will discuss in this session. So I hope you can join us. And also we will talk about the implementation at national and regional level. What are the challenges and the potential opportunities, and what support we can have from our regional economic commissions and other partners. And then on Sunday, we will have a Twitter chat led by Africa CDC about AMR in the African context, and the hashtag will be Africa WAAW. It's the World Awareness Week, and it will be moderated by Vanessa Carter. And we have here the link that we will share with you now in the chat box. And it will start at 7:30 Eastern African time. Now on Monday, we will talk more about implementation and financing of AMR national action plans. We will have 3 country experiences, one from Ghana, one from Uganda, and one from Egypt, to talk about their also success stories, their lessons learned from implementing and developing and financing national action plans. And then on the 23rd of November, we will have a session led by Africa CDC and UNEP about the role of civil society organization and professional bodies in combating AMR, and we will focus on lessons learned from COVID-19. We will hear also from patient stories about their experience with AMR and how they have addressed it in their daily lives. We will, in the discussion, try to focus on improving engagement with civil society organizations and professional associations also to prevent AMR in Africa. We heard a lot in the panels that preceding that this community engagement part is very important, and we have to work on it more. So I hope this session can provide us with some of the solutions to this. The last day of the week will be a session on, again, One Health approach and multi-sectoral coordination mechanism for AMR, and it will be led by OIE. And we will try in this to have two panels, one on the private sector engagement in AMR governance and One Health approach, and the second one on the research institution engagement and how they are embracing One Health in AMR research and development. So this is our plan for the week. I hope you can stay tuned and join us in all of them. Now we will open the floor for a discussion. And I would like first to give the floor to Wendy to take us through the, or give us some hints from the session that Africa CDC and UNEP will lead later in the week. Over to you, Wendy.
Thank you very much, Chadia, for that nice succinct overview. We are really delighted in collaboration with UNEP to host this special session on the 23rd. Just as a start of our engagement with civil society groups as well as the media, this organizing committee was able to host a capacity building workshop just a few days ago as sort of a pre-event of this long week of exciting events that we have put together. But uniquely, this session will be showcasing in advancing the awareness around AMR. We have put together several experts and speakers from various sectors, including consumer protection, as well as patient safety sectors, and of course, agriculture sectors and infection prevention and control sectors. The purpose of this is really to create an awareness and opportunities, to showcase opportunities that are available for civil society organizations, youth groups, women groups, farmers groups, media, professional groups, and various other groups in how they can help us in driving behavior change and creating awareness on how we should all properly handle antimicrobials. So ladies and gentlemen, and our distinguished delegates, we definitely look forward to having you on that session, and I will hand over back to Chadia. Over to you, Chadia.
Thank you, Wendy. I would like to give the floor now to Irene from FAO.
Merci beaucoup, Shadia. Je vais prendre l'opportunité de parler en français, au moins pour les francophones.
Thank you, Shadia. I'll speak English. I'll speak French, sorry.
Yes. Just one second, because I'm turning this translation. Donc, bonjour, chers participants.
Good morning, good afternoon to all participants. Tomorrow, we will have a session on regulation and legislation. This is a very important session, and I invite you all to participate, because very often we believe we need a special legislation for AMR, but in fact, all types of legislation that approach antimicrobials are important for AMR. So we'll have different presentations from FAO, OIE, and WHO. And we will see how, with the One Health approach, we can enforce legislation on antimicrobials. We will also discuss the One Health tool that has been developed and that should help countries to evaluate all the pieces of legislation that exist to see which ones are relevant for AMR. And maybe we can make recommendations. And then we will have a final discussion. We will try and identify the problems that exist in the countries and that are an obstacle to the enforcement. We did talk about it previously, but I think that we should have a general discussion on all these obstacles that exist, and we will try and see how the RECs can help the countries to enforce their legislation. So that's more or less what will happen tomorrow. And we will be very happy to welcome you. Of course, the UNEP, African Union will be with us as well. Thank you and see you tomorrow. Back to you, Shadia.
Thank you very much, Irene, for this overview of the sessions. I want to make sure that we have our colleagues from WHO, if Dr. Hala or Walter on the line.
Chadia, I am here. This is Walter.
Yes.
And thank you to the participants for being here today and opening this WAAW commemoration with us. It's a pleasure, and we are very appreciative. On day 4, which would be on Monday, the 22nd November 2021, we'll be looking at the implementation and financing of AMR national action plans. We thought this was very important and critical. As you know, effective implementation is the Achilles heel in some of our countries in terms of what they are doing in the AMR space, but also financing is an important element if countries are going to be able to effectively implement. As we heard from some of our speakers today, we need to ensure that there is dedicated financing. And so we thought it was important to look at what some countries are doing and have them share their experiences in terms of the financing and implementation of national action plans. And so in this regard, we are going to be having Ghana, Uganda, and Egypt to share their experiences, and maybe we could have some lessons learned as to how to be creative or go about implementing or financing national action plans. So I hope that you will join us on this day. I think it would be a very interesting discussion. And of course, we always want the participation of the audience because this helps us in understanding what is going on and have them share their ideas. So over to you, Chadia.
Thank you, Walter. Thank you, everybody, for this overview. I want now to open the floor for the participants. If there's any questions you would like to address to our colleagues, the focal points for the different sessions. You can raise your hand or put it on the chat. Yes, Dr. Najmu, please go ahead.
Yeah, first I'm thanking for all of you, CDC, the WHO of the organization. I'm from Somalia. So today I get a lot of things in antimicrobial resistance because of in my country, we don't have a legislation, we don't have a regulations that can reduce or eliminate the consequences of antimicrobial resistance. So today I'm very happy to participate in this webinar and I will continue inshallah. So I'm thanking you for all of you. Thank you.
Thank you, Dr. Najmu. I hope you find it useful and also the different sessions during the week so to provide more information for you. Any other contribution, comments, or questions? Yes, Irene, please go ahead.
Okay, merci beaucoup, Shadia. Peut-être qu'il faudra rappeler le lien pour les autres sessions.
Maybe you should send the link for the next sessions. Maybe you can send the link for the next sessions.
Yes, we will share the new links for all the sessions later today, just after we close this meeting, and we will share it by email. Thank you.
Okay, merci, Shadia.
Welcome.
Thank you,
Nancy,
Shadia.
Nancy, you have a question?
Yes, I do. Okay, hi everyone. I'm Nancy from Kenya. And the issue in Kenya is everyone is used to antibiotics, and it's like it has become a norm. Like any citizen can just prescribe a medication. Most of them have become resistant to them. I don't know if there's a way we can help them. Anyway, I know it's hard to get to everyone across the country, but how I wish everyone had the knowledge to be educated on the effects of taking too much antibiotics. I'm an advocate for AMR, but I don't know if I can join an organization in my country, but I'll check it out. It's an issue here. Thank you.
Thank you, Nancy. If I heard you correctly, because the line wasn't clear, it's about community engagement and how to reach everybody with the information about AMR. I want to call on Walter, if you can provide some feedback on this.
Yes, I share that same concern, and this is why, as Dr. Gabriel said, awareness and advocacy is very, very important. And this is not just an issue for the governments. It's not just an issue for the UN institutions or Africa CDC, but it involves all of us. And so we must find a way, and we must continue to spread the message about AMR, hence the theme, spread awareness and stop resistance. And when we are saying spread awareness, we are not just talking about the UN agencies. We are talking about everyone who is part of this session today in our respective communities. We are talking about civil society organizations that were with us just a couple of days ago, and the media. And so it is only when we engage in awareness at all levels and advocacy that I think would begin to reach the masses and have everyone involved in addressing this issue. And so we should all get involved. The different organizations have different tools and platforms, and I will encourage all of you to visit those platforms, Africa CDC, OIE, FAO, WHO, UNEP, with materials that have to do with advocacy and awareness and how you can get involved. This is very important. Over.
Thank you very much, Walter. Indeed, it's very important to have everybody involved, but there's also the responsibility at the individual level. We have to start with ourselves, how to use the antimicrobial or antibiotics, how to dispose of them, and how we can support the awareness raising with our families, with our colleagues, and in our workplaces. We have to be the role model for our communities. I want now to give the floor to Estella. Estelle, kindly mute yourself and ask the question or the comment.
Hi, good day, everyone. Hi, my name is Estelle. I'm calling in from Nigeria. And just to add a quick note to Walter's comment and the previous comment from Kenya around how we engage the communities. So I run a healthcare consultancy NGO based in Abuja, and we're actually currently running an internship program supported by FAO for 25 interns across Africa, and the interns and mentees from the One Health. So we've got pharmacists, vets, doctors, microbiologists, students, and agriculture students. And we're actually doing something very interesting with them for the WAAW week, where we're getting them to address this awareness conversation and we're going to be showcasing them, explaining what antimicrobial resistance means in their various languages. So this is, a very interesting exercise because we know that we have this high-level discussions about AMR and what AMR means, and we use this phrase. We use the the hashtags. We use AMR in conversations. We talk about antimicrobial resistance, but when you actually drill down to the communities, it's very difficult to translate to what this actually means. So this was an opportunity to get, have the youth involved in the mitigation of this challenge. And I think it's something that it's very important that we sort of engage the youth more, think of innovation from the youth voice. And we do this with, with a platform that we call the Youth Against Antimicrobial Misuse Project. And so this is, this internship is a great opportunity for the youth and the, undergraduates and maybe graduated across these 5 streams to really discuss, learn together. They're also obviously across different African countries, both Anglophone and Francophone, and sort of engage in a way that they can really share ideas, learn lessons in a One Health perspective. So, the youth voice is a very strong one that we can use and build on. And then the next thing I just wanted to add is that we're, in terms of the global, trying to understand what the position is for AMR across the continent, I think if there's an opportunity to do some kind of mapping of different stakeholders, different activities, different projects, different resources across the continent, to see who's doing what, who's playing where, who's working in what space. And then it will really be a great opportunity for us to, such a project or such an output will be really great to really understand where the gaps truly are. And we can then use that to sort of build both, from the investment case to build for, the resource mapping, to build for expertise and, share lessons across the continent. So if this this opportunity is open, it's really going to be very, very, very great opportunity to learn from and identify the gaps, identify the strengths, and of course, use it to learn lessons as well. Thank you so much.
Thank you. Thank you, Estelle, for this great work, especially the work with the youth and students. For the issue of stakeholders and mapping, actually the tripartite, FAO, WHO, and OIE, they are doing this exercise now, mapping the stakeholders in preparation for the launch of the global multi-partner stakeholder forum on AMR that will take place in next year. Thank you very much to everybody for joining us in this inaugural session for the Awareness Week on AMR. We look forward to seeing you during the week in the different sessions that we outlined to you in the overview. And just to mention that we will share the new Zoom links for all the sessions later today via emails to everybody. I would like to close by thanking you all for participations and for the good discussions that went in the chat and later here. Thank you and have a good day. Bye-bye.